It's time now for the second part of our Pets and People column for today. Earlier in the show, Dr. Marty Hopson was here to begin a series on issues facing older pets, specifically diabetes. And yes, cats and dogs can receive that diagnosis. And Marty's back with us now to talk about treatment and about the signs pet owners should look for.
So at home, it can be pretty dramatic, although this is a chronic illness that may have been developing over a certain period of time, but you sort of cross that threshold. So you see an animal that is quite overweight and maybe now is suddenly losing weight, but they're still eating. In fact, they're eating a lot because what's happening is the cells aren't getting the glucose they need for energy. So the body, the brain still thinks, we're hungry, we're starving. So your animal is eating, and yet it's starting to actually break down its own fat cells for energy. The other hallmark is really excessive thirst and urination. So as that glucose goes into the urine, that pulls water from the rest of the body. So you're peeing a lot, and therefore you're thirsty all the time too. So an overweight cat may or may not be losing weight, still eating a lot, and really soaking that litter box and just emptying the water bowl all the time. And then at the clinic, you'd take a blood glucose reading, which is just a simple test. Sometimes just like people, we use those lancets on the ear and just take a tiny drop of blood. So you're looking for high glucose in the blood and in the urine at the same time over a certain level for an extended period of time, if that's not too complicated.
And one of the repercussions of diabetes for humans we think about is cataracts. Does this happen in cats as well?
Not so much in cats, but dogs do. And it's kind of neat the way this happens. So your lens is clear because the fibers are arranged sort of in a lattice in a very certain way. When that high level of glucose is present, water gets drawn into the lens of the eye, and that disrupts the fibers so they don't remain in that matrix anymore. Therefore, the lens turns opaque and the dog becomes blind. And that is irreversible. There isn't anything we can do other than cataract surgery. But cats' eye lenses have a different structure, so that doesn't happen with cats. But another pretty interesting thing that is really sort of, when you see it, you think, oh, that's a cat that probably has diabetes. You see these cats that are really flat on their back legs. You know how you think of cats walking on their tippy toes, kind of on all four legs? Well, if you can picture their back legs kind of almost collapsing, so they're walking more like you'd picture a rabbit sort of getting around. It's called a plantigrade stance, and the reason it's happening is this is a peripheral neuropathy, and the high levels of glucose actually change the chemical structure of the nerves going to the back feet, and so that disrupts how the nerves are transmitting signals to the brain. So once the diabetes is corrected, that problem actually does go away and the cats will walk normally.
So what does this mean then as a pet owner? If you do have a pet, an animal diagnosed with diabetes, how does that change things? What can people expect their role in all of this?
Yeah, well, it's a great sort of good news, bad news story. So the good news is many cases can be managed, but it's not something we can correct and fix, and you never have to worry about it again. Insulin injections are most often needed either once or twice a day. The owners have to learn how to do this at home, and it can be really easy, but initially that seems really scary, you know, that you'd have to give a needle to your cat twice a day forever. So we do a little bit of training, and I've brought in some props for you. So you have a small vial there with insulin in it. Then you would draw up the required amount, which is really tiny, by putting the needle in just as you're doing and sucking some out. So usually it's a really tiny amount, and you'll also notice, Matt, that the needle is really, really small, right?
Yeah, it is.
That almost looks like one of those acupuncture needles I showed you before. And what we do is get people to sometimes, the first few times, practice on some fruit. So I've brought you an orange.
I'm going to stab an orange.
You could use an apple, and you would gently pull up on the skin of the orange, which is hard to do. And you would, just on that exact little angle you've got there, kind of a little more flat, you would push that in. And then before you push the plunger, you would usually draw back on the plunger once the needle's in to make sure that there's no blood. And then you would gently depress it and put the insulin in. So it's not that hard, and the cats and dogs usually don't even notice. You're usually giving insulin at the same time as food, so they might be, eating their meal and totally oblivious to what you're doing.
And is this usually like scruff of the neck, or where would you recommend people do the injection?
Scruff of the neck is very comfortable for animals because it's loose skin there. But what people do is generally rotate. So you might imagine kind of a clock face over the back of your animal. So you might be doing neck and then a shoulder and then further down on the back and the other shoulder. Because if you always put it in the same place every time, you get quite a callus there in the skin.
Sure.
Because this as I said, is going to be going on for years as long as your animal stays healthy. The other downside of it is that it's kind of a challenge to manage. In some cases, diabetes is like a puzzle, and you don't always get the right puzzle pieces in the right order the first time. So we try a certain dose of insulin, but then your animal's going to have to come back to make sure everything's okay. So you are looking at kind of a pretty big initial financial commitment, but if everything can sort of get organized and managed quickly, then things are not so bad. Insulin is not expensive at all because we're dealing with such tiny amounts as well. But it is something that has to be treated. You can't get a diagnosis of this and then decide, I'm not going to do anything at all. Eventually, the fat stores break down, and that causes a lot of problems, specifically an emergency situation called ketoacidosis, and your animal can actually die from this.
And what about diet? Does that have to change for your pet?
It can play a really significant role, and in cats especially, diet can make a big difference. Sometimes if you get the cat to lose the weight and change the diet, the cat actually can go to a place where he doesn't need insulin anymore. So that's a great thing. And in those cases, we're still talking about management, but it is almost like a cure because you can get that cat off insulin. So that's pretty cool. We used to use a high fiber, low fat diet for weight loss in cats, and sometimes we still do. It really depends on the cat. But there's a newer specialized diabetes diet that's been around probably for about 10 years now, and it's very high protein and low carb. So that sounds pretty familiar to you.
Sounds kind of paleo Atkins diet.
Like an Atkins diet, yeah, except that in veterinary medicine we sometimes call it the Catkins diet. Ha, ha, ha. So some cats do really well on these, and they do manage to lose the weight, and we can decrease their insulin that they need or even discontinue it.
So we're going to talk a bit more about issues facing some older pets in the months to come here.
Yeah,
right,
I look forward to coming back again and talking to you soon.
Appreciate this. And can I eat this orange now? Is that okay?
That's actually mine.
Here's yours.
Yeah.
Marty, thanks for coming in.
You're welcome.
That is Dr. Marty Hopson for our Pets and People column. And again, thanks to Marty and to the Companion Animal Welfare Initiative for their help in putting this series together for us.